So what is the important differential diagnosis of a trigeminal neuralgia? Number one is a trigeminal autonomic cephalalgia. So trigeminal autonomic cephalalgia, like a cluster headache or a SUNC or a SUNA, can present with severe craniofacial pain. And actually, if you take trigeminal autonomic cephalalgias like SUNC, they can actually even have cutaneous triggers. But the cutaneous triggers in SUNC will not have a refractory period, whereas the cutaneous triggers in a trigeminal neuralgia will have a refractory period. So this is cluster. Basically, your trigeminal autonomic cephalalgia is an important differential. Next is a trigeminal neuropathy. So the question is, when do you suspect a trigeminal neuropathy? I already mentioned, when you have an objective sensory loss or a negative sensory symptom over the face, that itself says that you might be dealing with a trigeminal neuropathy. Second, if you have a bilateral trigeminal neuralgia, usually trigeminal neuralgia is unilateral, but if it is bilateral, you have to suspect a secondary cause. If the patient is young, okay, usually trigeminal neuralgia is a disease of the elderly. But if the patient is young, that time you have to suspect a secondary cause or a trigeminal neuropathy. Next is if the patient has a non-paroxysmal pain. So usually trigeminal neuralgia, they have paroxysms of pain. Between the paroxysm, they are normal or they don't have any pain. But in a trigeminal neuropathy, they might have a dull, aching, non-paroxysmal pain on and top of the paroxysmal pain. Another important diagnosis is temporal arteritis. That is your giant cell arteritis. So that can also present with scalp pain and craniofacial pain. That is also important differentials because the treatment is different and it can be vision threatening.